Imagine a simple blood test that could help doctors find certain cancers, check if treatments are working, or even warn about cancer coming back. This test is called the alpha-fetoprotein, or AFP tumor marker test. It's not a household name, but it plays an important role in modern medicine for many people. So, what exactly is the AFP tumor marker test? In short, it's a blood test that measures the level of a protein called alpha-fetoprotein in your blood. Normally, this protein is made in large amounts by unborn babies as they grow. But after birth, AFP levels drop quickly. And in healthy children and adults who aren't pregnant, AFP is found only in very small amounts. For most people, AFP doesn't play a big role unless something unusual is happening in the body. Doctors often use the AFP tumor marker test for one main reason: to help diagnose and monitor certain types of cancers, especially those of the liver, ovaries, or testicles. If you're not pregnant and your AFP levels are higher than normal, it could be a sign that your liver, ovaries, or testicles might have cancer, or that your body is reacting to another health problem. But it's important to remember that this test isn't a crystal ball. It can't diagnose cancer on its own, and it doesn't replace other important exams and scans. Sometimes, conditions that aren't cancer, like liver disease or even just an injury, can cause AFP levels to rise. And in some cases, people with liver, ovarian, or testicular cancer might still have normal AFP levels. That's why doctors use this test as just one piece of the puzzle, alongside your symptoms, medical history, and other test results. So, why would your doctor order an AFP tumor marker test? There are a few reasons. If an exam or scan suggests you might have cancer in your liver, ovaries, or testicles, this test can help confirm or rule out the diagnosis. If you're already being treated for one of these cancers, measuring AFP can show if your treatment is working. For example, if the AFP levels go down, that's a good sign the cancer is shrinking. If you've finished treatment, the test can help doctors watch for cancer coming back, especially if your AFP was high before. For people with chronic liver diseases like hepatitis or cirrhosis, the AFP test is sometimes used to watch for early signs of liver cancer. A sudden jump in AFP can be an early warning signal, even before other symptoms appear. However, most experts don't use the AFP test alone to screen for cancer in these cases, since many things can affect the results. Getting the test is simple and quick. A healthcare professional will draw a small sample of blood from your arm, which is usually over in less than 5 minutes. You don't need to fast or do anything special to prepare. There are very few risks. Maybe a little soreness or bruising where the needle went in, but that usually goes away quickly. Once your results come back, your doctor will look at the AFP levels in your blood. If you haven't been diagnosed with cancer, a high AFP result might be a red flag, but it doesn't mean you definitely have cancer. Other things, like liver injury or non-cancerous liver diseases, can also raise AFP. Sometimes, other cancers like lymphoma or lung cancer can also cause high AFP, though this is less common. On the other hand, if your AFP levels are normal, it's a good sign. But it doesn't rule out cancer completely. Some people with liver, ovarian, or testicular cancers never have high AFP levels. The key is to look at the whole picture, including your symptoms and other test results. If you're already being treated for a cancer that increased your AFP, your doctor will likely test your AFP level several times during treatment. If the number is going down, it means the treatment is probably working. If it's going up, it could mean the cancer is growing or spreading. And if it stays the same, the disease might be stable for now. After treatment, regular AFP tests can help watch for signs that the cancer might be coming back. If your AFP rises again after being low, it's a clue that doctors need to look more closely for a recurrence. For people with long-lasting liver conditions, a sudden rise in AFP may signal the development of liver cancer. In these cases, doctors may order more tests, like imaging studies, to get a clearer picture. So, what does all this mean for you? If your doctor recommends an AFP tumor marker test, it's just one tool among many to help keep you healthy. It's not a diagnosis on its own, but it helps guide decisions, monitor progress, and catch problems early. Always talk to your doctor about what your results mean for your unique situation. To sum it up, the AFP tumor marker test is a helpful, simple blood test that can provide early clues about certain cancers, track how well treatments are working, and help monitor for cancer coming back. It's a small test with a big impact, giving doctors and patients another way to stay one step ahead when it comes to cancer care and liver health. If you have questions about the AFP test, or if you're worried about your risk for cancer or liver disease, don't hesitate to ask your healthcare provider. They can help explain your results and guide you on the best next steps for your health. Remember, early detection and regular monitoring are key tools in the fight against cancer and serious liver diseases. At MediByte, we believe that understanding your medical tests empowers you to make better decisions for your health. Today, you've learned what the AFP tumor marker test is, why it's used, and how it can help you and your doctor. Stay informed, ask questions, and take charge of your health journey.